This meeting is being recorded.
Okay, so welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors. Today's meeting is officially called to order. So for the record, please note Dr. Michelle Morse is representing Dr. Ashwin Basan. Erin Kelly is representing the Deputy Mayor Ann Williams Isom. Dr. William Fisher is representing Deepa Avula, and Karen Sanhilaire is representing Molly Waso Park, all in a voting capacity. Also note for the record, Sari Hernandez Pinheiro is participating virtually in a listening capacity. So next on the agenda is the adoption of the minutes for the Board of Directors meeting held on January 12, 2024. Are there any questions, comments, or changes? Can I hear a motion to accept the minutes? All in favor, please say yes.
Yes.
Opposed, say no. So the motion carries. During the executive session, the board received and approved oral and written governing body submission from NYCH&H Susan Smith McKinney Nursing and Rehabilitation Center, Henry J. Carter Specialty Hospital, and Henry J. Carter Nursing Facility. The board received and approved semi-annual governing body report, written submission from NYC Health and Hospital Seaview Nursing and Rehabilitation Center. So let me move on to Vendex approval. Since we began the process of approving contracts prior to Vendex approval, there are 3 items on today's agenda requiring Vendex approval. They all have that approval. There are no items from previous board meetings pending Vendex approval. Since we last met, 3 approvals were received. We will continue to notify the board as outstanding Vendex approvals are received. So I'm going to move on now to the resolution. So it's item 6 in your agenda. And that's authorizing New York City Health and Hospitals Corporation, the system, to execute a 99-year sublease, including tenant renewal options, with the Fortune Society, Inc., on an affiliate housing development fund corporation formed for the transition of the 6-story building to staff house containing approximately 55,000 square feet, the building, and the land on which it is located measuring approximately 30,000 square feet, including surrounding grounds and 10 parking spots, the property on the NYC Health and Hospitals Jacoby campus, to be renovated to create a multi-family residential building with 84 units of affordable housing for households earning less than 80% area median income, community rooms, a lobby, and on-site social service suite, including 58 permanent supportive housing units for formerly incarcerated medically complex individuals who would otherwise be homeless, 25 units of affordable rental housing for low-income households, and 1 living supers unit at no charge other than an annual lease servicing fee of $12,000, increasing by 5% every 5 years, and authorizing the system to enter into a 15-year contract with Fortune to provide on-site comprehensive supportive services for the building's residents at an annual cost of $1,050,000 a year for a total cost over such term not to exceed $15,750,000. And this was presented to the Capital Committee on January 19th, 2024. Thank you.
Good afternoon. My name is Leora Jontef. I'm the Assistant Vice President for Housing and Real Estate, and I'm here with my colleague, Ellie Epstein, Assistant Vice President at Correctional Health Services. Some background on New York City Housing for Health, an initiative that we launched in 2022 to provide housing supports and opportunities for our vulnerable patients experiencing homelessness. H&H land assets provide an opportunity to create affordable and supportive housing for our patients and other New Yorkers in need, and that is one of our contributions to this administration's housing plan, Housing Our Neighbors. H&H partners very closely with the New York City Housing Preservation and Development for the financing of these projects. HPD provides the capital subsidy as well as the rental subsidies for this project, and H&H works to develop continuity of care with our local facilities. Next slide, please. For some background and history, how H&H has used our land and partnered with other city agencies for the development of affordable and supportive housing. There are 10 multifamily residential buildings on our land at Kings County, Metropolitan Hospital, Queens Hospital, Seaview, and Woodhull. And in particular, our most recent ground lease was for the development of 93 units at Woodhull, which will open later this year. And we're really excited that this is the next project in our queue. Next slide, please.
Thanks again, everyone, for having us. So, as you know, Correctional Health Services provides healthcare and wraparound support to people in the New York City jail system. The vast majority of our patients actually don't go to prison, but rather return home to the 5 boroughs, and we work hard to support their reentry and to ensure continuity of care. Unfortunately, many of our patients, almost 30%, report being homeless. Securing housing is especially challenging for our patients with complex medical needs, as they are particularly ill-equipped to navigate the city's shelter system. Existing housing programs are not designed to support their needs, and most don't qualify for skilled nursing homes. The Just Home program has been conceived in order to meet the needs of this unique cohort of patients. Just Home will be a first of its kind permanent supportive housing project for formerly incarcerated people with significant medical needs. Next slide, please. So as I just mentioned, Just Home will be permanent supportive housing. What that means is that the apartment unit is affordable and comes with a lease, and that there are wraparound social services provided to the resident of that unit. By providing stable, safe housing with on-site social services and easy access to clinical care, we can help prevent the institutional cycling that some of our most vulnerable patients face. 70% of the units in the building will be reserved for former CHS patients and are supported programmatic units, meaning that the residents of those units will be referred by CHS based on their clinical needs and or the level of support that they need in order to complete the activities of daily living as determined by our clinicians. So I just want to note that although individuals will be considered for housing while they're in custody, meaning that they're either pretrial detainees or city sentenced, they cannot and will not move into this housing unless they've been released from custody. In addition to identifying individuals and facilitating their application for housing consideration, CHS is also providing funding for the provision of case management, care coordination, and tenancy support services for these individuals. The remaining 30% of units are not considered supportive housing units, but rather are units of affordable housing that are available to members of the public. Leases for those units are awarded via New York City Housing and Preservation Development's Housing Connect service. Next slide, please. So in 2022, HPD designated the Fortune Society to be the developer of Building 2 on the Jacobi Medical Center campus in order to create Just Home. They were chosen from an RFQ that pre-approved 44 developers. Fortune is uniquely qualified to be the developer and provider for Just Home, and we're super excited about working with them. They are an incredible nonprofit that focuses on supporting people with lived experience of the criminal legal system. The majority of their staff are people of color and have lived experiences that directly reflect those of our patients. And they've been serving this community for over 55 years and have been a direct provider of housing for their clients for over 20 years. They are one of CHS's most important reentry partners, and we refer patients to them daily. Most recently, they opened the Mandela Community, which is a permanent supportive housing program for 57 justice-involved seniors in the Bronx. Fortune maintains that building, provides security, and delivers supportive services to all the residents in that community. So I'm going to turn back to Leora to talk about the property they'll develop and then continue to talk about the services.
Sure, next slide, please. Just to orient you a bit to the Jacobi campus, this is Building 2, the former staff house on the western part of the campus, is an underutilized building that would be renovated into housing. The new address for the building would be on Pelham Parkway and not on Seminole Avenue. Next slide, please. The Fortune Society would execute an up to 99-year ground lease for Building 2 and the surrounding grounds for a nominal fee. Fortune will also pay $12,000 per year as a lease servicing fee, escalating by 5% every year to H&H. At year 15, the cash flow and the capital needs of the building will also be assessed. Fortune will be required to renovate the building to become 83 units of affordable and supportive rental housing. They will be solely responsible for building operations, and they will partner with H&H on patient referrals. The renovation will also include 2 community rooms, a resident-only test kitchen, culinary training center, 24/7 security desk, and a social service suites. As is typical for supportive and affordable housing projects, the developer, in this case Fortune, is solely responsible to secure the $40 million financing needed for this renovation. That includes city, state, and private funding sources. HPD is vital to this project. We estimate about 60% of that money would be HPD city subsidies. H&H will have no obligation for the renovation of the building. That's solely on Fortune. They take out the debt and they put the financing scheme together. Next slide, please. Fortune will be required to renovate the building, as said earlier, to become the 83 studios of affordable and supportive housing. There'll be 58 permanent supportive housing units, 25 affordable units, as Ellie said, marketed through New York City Housing Connect, and 1 live-in supers unit. This building will be highly regulated. HPD will mandate a 60-year regulatory agreement, assuring the rent-stabilized leases and affordability of the households shall not exceed 80% of the area median income. Every tenant in the building will get their own rent-stabilized lease, and they will not pay more than 30% of their income on rent. The supportive tenants will also benefit from a city rental subsidy estimated to be over $1 million a year. There will be on-site services at the building to be provided by Fortune, which Ellie will go into in a little bit more detail. Next slide.
So under the service contract with CHS, Fortune will deliver services to the 58 people who will live in the Just Home programmatic units. These services will ensure that former CHS patients with complex medical needs and/or functional impairment are able to remain housed, build and maintain a social network, obtain government benefits, and remain engaged in healthcare. Fortune will employ a team of licensed clinical social workers, peers, housing specialists, and case managers to ensure that residents are able to manage their daily needs, maintain their apartments, and engage in care. Fortune will also ensure that there is 24/7 security on site, maintaining a secure front desk post at all times in addition to cameras. So although this represents a pretty significant security presence, certainly much more than most residential buildings, including my own, it is very standard for supportive housing practice. In addition to making sure that everyone's needs are met, Fortune will host pro-social events like movie nights or cooking classes available to all residents, including those in the affordable units. The services funded through this contract will be augmented by Medicaid-funded services like in-home services, and they'll also leverage the incredible community-based care resources that H&H makes available to all of our patients. Next slide, please. So as we already mentioned, in supportive housing projects, the nonprofit developer is almost always also the provider of services. And indeed, Fortune is the solely responsible for delivering services in all of their properties. This is considered best practice and is mirrored in other projects, such as those run by Communal Life. Fortune is an incredibly experienced housing provider, and they're also only one of 3 nonprofits to have been awarded contracts by the DOHMH for justice-involved supportive housing. We're seeking approval to enter into a 15-year contract with Fortune to provide the Just Home supportive services. The contract will not go into effect until the renovation of Building 2 is complete and tenants are able to move in. The contract award is about $1 million a year for a total cost not to exceed $15.75 million, which is funded by CHS and has been baselined in our budget. The funding level and the 15-year cycle is aligned with the award amounts set by the city for other supportive housing projects. Next slide, please. So just to close, we wanted to share the projected timeline for this project. Again, back in July 2022, HPD designated Fortune as the developer of Building 2 on Jacoby campus in order to create Just Home. Since that time, we've worked with HPD and Fortune to meet with elected officials representing the district, the Jacoby Hospital Community Advisory Board, and Community Board 11. We've also attended and hosted a number of community meetings, and most importantly, as required, we hosted a public hearing at Jacoby Hospital on December 13th. So if the board approves the ground lease and the service contract for Just Home today, then we'll move forward with the necessary city council votes this year. Upon receiving approval from City Council for the ground lease, Fortune would then proceed to the Department of Buildings for plan submission and review, and then would work to secure financing. All this to say that we would hope to have the ground lease executed towards the end of the year so that construction could begin, with a goal of hopefully moving folks into apartments sometime in 2026, and at that point we would then execute the service contract. This is admittedly a complicated project, lots of moving parts, and so this is only a projected timeline. It's subject to change. Unfortunately, what is not going to change, if anything is only likely to increase, is the real need for this project. We have folks who deserve and need housing and the benefit of our support, and this opportunity will allow some of our sickest patients to live with dignity, comfort, and the support that they need. And with that, I just want to say a huge thank you to my colleagues who have helped us get to this point, and a huge thank you to all of you for your time and consideration, because it's a really important project that means quite a lot to us. And final slide. So just to conclude, I'll remind you that we're asking the board today to approve the 99-year ground lease for Building 2 at Jacobi Medical Center to the Fortune Society, and to allow CHS to enter into a 15-year contract with Fortune to fund the wraparound services that will be provided to the residents of Just Home. And with that, we would be very happy to take your questions.
So thank you so much for your work on this, and I would also add that your packet includes the remarks that we made during the December meeting, the comments, written comments, and the comments from the different speakers, and then the questions, how the questions have been answered for your reference. So any questions from board members? Mr. Calamia?
Yes, so I know it's obviously a couple of years away, but I'm sure you've thought through this process. The referral pattern from the patients that are currently in the system, they're going to have a certain level of medical need. How do we judge that, and are there specific minimal requirements in their medical needs? Are there maximal requirements that would make them more appropriate for SNFs, or other types of facilities? Who's doing that, by the way? Who actually makes those judgments?
I think it's a great question, and actually we're really excited about this. I think it's one of the things that makes this a really unique and special project. The unfortunate reality is we're only talking about 58 units. Sadly, we do have a patient population whose needs exceed that. So in terms of, I'm going to start with the high end of kind of level of need, because that's in some ways the easier, which is recognizing that these are apartments, and while there will be wraparound supportive service available, and also in-home services, like for example, if folks need a Medicaid-funded home health aide or something like that, that's available. But individuals who really would benefit and need what you're describing, like a 24/7 skilled nursing support, that's not an appropriate referral for this housing. So the kind of first cut is Correctional Health Services is already caring for these patients while they're in custody. So we're very familiar with their clinical needs and their functional ability. And so folks who we identify, and this is true today, who we recognize benefit from a skilled nursing facility, that's really the referral pathway that we're pursuing. They would not be considered a candidate for this housing because it's not enough support. Unfortunately, and sort of with public misperception sometimes, the majority of our patients that we're thinking about are really folks that are just below that, people who really do need a home health aide, and maybe if they had housing in the community, then we would just arrange for that level of service and they could remain at home. But so they lack the home. That's really the essential ingredient. And so it's folks who we recognize could live independently, but for a home health aide, a case manager, a care coordinator. That's really the group of patients we're thinking about, and really primarily will be our infirmary care patients. So the question is, the answer to your question really is, CHS clinicians will make the decision about who is an appropriate candidate based on their medical need and their functional abilities. And then from there, we would refer those individuals to Fortune, and the Fortune Society, who is an experienced reentry service provider and housing provider, does their own screening process to determine, is this somebody who's going to be a good fit for the community? Is this somebody who wants to engage in our services, who we feel confident we can support? Everybody wants folks to be successful. Nobody benefits if we refer somebody who is not a good candidate for this housing.
Thank you. Any other questions from board members?
I wanted, if I may, to make two comments about the project. First, that there is an absolute need for this kind of supportive housing for people with complex medical needs who are leaving Rikers. And in the absence of that, many of these homeless people wind up on the street. And they wind up on the street because their needs are too great to be met despite our great shelter provisions in the city. These are people who need more. Often they need their own bathroom, they need ready availability to medical appointments. And what often winds up happening is they live on the street. And none of us should want that. And that is certainly going to increase the recidivism level. And that projects like this of supportive housing make all of us safer because they enable people to live in a dignified way. Second, and I know this was a common issue that came up in the hearings, to many people this might feel like, well, but why here, why now? And I just want to remind us that we as a board made a commitment to use our empty facilities specifically for supportive housing whenever possible. Our facilities are where they are. We can't move them around, right? Nor is this our first use as the slide showed. This is not our first use of our facilities, and it's not unusual that supportive housing programs are not welcomed initially. And again, I think the Woodhull experience of Communilife very helpful. A lot of protests to the first building, no protest to the second building, right? A lot of fear. You're bringing in people might have mental health issues, might have substance use histories. They may have criminal records. How are we going to be safe in the community? Communilife puts up a beautiful building. They run a great program. They are a good neighbor. We want to do another one on the parking lot. No issues. In this case, this is our first one in this particular location, and I certainly can understand people's concerns. But I think that the reality will be that the program will grow up there and be a good neighbor. And then I last wanted to just point out to people that this is not a new issue. That in October 2015, the city launched the Justice-Involved Supportive Housing Program of 120 beds. In 2019, the borough-based jail plan points of agreement negotiated between the mayor and city council increased that to 500 beds. In January 2020, the city released an RFP for a total amount of $94 million over 9 years for 380 beds. And in June of 2021, the City Council approved the budget, which included a transfer of $1 million specifically for this program. So the commitment of the mayor, the City Council, to the importance of providing supportive housing for justice-involved people is much bigger than this program. It's much broader. It's gone on, but we are an important part of it because it has been very difficult to find other appropriate housing because these individuals that are medically complex need support. And that may not work as well in sort of scattered site housing where they cannot get the medical support they need the way they will in this. So I think understanding, and the board was listened very carefully at the public hearing, and we certainly understand the issues that people raise, but we believe deeply that not only is this the right thing, but that when it is built, everybody will recognize that it is the right thing, and the program itself will be an excellent neighbor for that community.
Thank you, Dr. Katz. Any other questions or comments from board members? Let me get your vote. Dr. Katz?
Yes.
Dr. Calamia,
Yes.
Dr. Fisher,
Yes.
Dr. Morse,
Yes.
Karen Saint-Hilaire,
Yes.
Erin Kelly,
Yes.
Barbara Lowe,
Yes.
I'm sorry, Anita Kawatra,
Yes.
Jackie Rowe Adams,
Yes.
Dr. Marton,
Yes.
Pagan, yes. So thank you, so the resolution is approved. Thank you so much.
Thank you.
So let me move on to item number 7 on your agenda. Authorizing the New York City Health and Hospitals Corporation to execute a contract with Seaman Construction Corp. To undertake a roof replacement of NYC Health and Hospitals Woodhull Hospital as part of correctional health services outposted therapeutic housing units for a construction contract of $16,096,003 with an 11% construction contingency of $1,778,981 to bring the total construction cost not to exceed $17,874,984. And this was presented to the Capital Committee on January 19th, 2024.
Good afternoon, board members, Dr. Pagan and Dr. Katz. I'm Manny Saez, Vice President for the Facility of Office Development. We're joined by my colleague, Oscar Gonzalez, Senior Assistant Vice President for OFD, as well as Gary Chung, Senior Assistant Vice President for Correctional Health Services. Request for this contract approval and this presentation will be taken through Oscar Gonzalez, and of course, our Senior Vice President, Patsy Yang is also with us from the Correctional Health Services.
Good afternoon, Dr. Katz, board chair, board members. I hope everybody's having a great afternoon. This is to talk about the roof replacement at Woodhull. It is not just a roof replacement, it's also tied to the OTXHU project, outposted therapeutic housing units that we're implementing within the building. The work itself is a phased approach. There is a prerequisite of work that has to be done, designed, constructed, approved by SCOC, approved by the Department of Corrections before we can implement. The first phase of the work has started and is on the completion end, which is the restacking or the decanting of the 9th and 10th floors and relocating those services throughout the hospital. The second phase of the work is the actual roof, which also incorporates the outdoor recreational space of OTXHU. The roof itself is beyond its useful life. It's nearing its serviceable life. It's almost no longer maintainable. It needs to be replaced. It's essentially immediate. It also provides, the roof integrity provides a vulnerability to the interior of the space. So implementing phase 3, which is the OTXHU program within 9th and 10th floor, would be subject to the elements of water infiltration within the building. So, and as evidence of the water infiltration, the recent events that we had back in September of the major flooding where we had to shut down the hospital at Woodhull would provide proof that there is water infiltration, not just in the roof, but other areas, but specifically for this particular phase, which is looking to replace the roof itself. The design for the roof is complete. It was completed by our architects, APS, Architectural Preservation Studios. The roof design was completed back in May. The roof is approximately 52,000 square feet of space. The sequencing of the roof is to remove the current roof system, install a new roofing system, which is essentially a bunch of different layers, a vapor layer, insulation, drainage, mats, pavers, and a cold fluid applied membrane. So it's a very intricate system that's commercialized in order to last us a very, very long time. In addition, we would be replacing the lightning protection system, implementing roof and drain and storm drainage, and a railing extension all around the perimeter. We did request and receive bids from general contractors to include a bid alternate, which is not just to replace the roof, but also the foundational work of the outdoor recreational space for OTXHU. So we are proceeding with this prerequisite as a phase 2 in order to be able to start phase 3. If we get your approval today, we should be able to start the construction work in March 2024 and complete in about 12 months, March of 2025. The procurement required us to solicit on city record, which we started in October of 2023. 17 vendors did attend. Out of those 17 vendors, we only received 2 bids in December, but we did determine that Zaman Construction is the lowest responsible bidder. The next slide shows you a little bit of org chart on how the program is set up. We have New York City Health and Hospitals, OFD, and CHS together are the owners. We have ACOM as the program manager overseeing the entire program. APS, Architectural Preservation Studios, is a designer of record, and Zaman Construction would be the general contractor. The next slide shows you the project budget breakdown. The project is fully funded by OMB for a total of $18.6 million. The CP, an original CP was approved for $11.6 million back in March of 2023, and there is an amendment currently at OMB for $7 million, and we're expected to get that approved very soon. The construction-based contract would be for $16 million with an 11% contingency. We did do a similar roof right next door on the 5th floor, same size, same dimensions, and we did find that we exhausted most of our contingency, but we did not exceed. So therefore, we're just adding a little bit more just to give us a little bit more cushion. So that 11% yields $1.8 million contingency to bring a total amount of $17.9 million that will go to the contractor. The last slide just shows you that Zaman is a certified MWB vendor, so we confirmed with our vendor diversity team, and this is a 100% MWBE procurement and contracting opportunity for us. The Zaman does not have any previous experience with H&H, but they do have city experience. They have worked with the MTA, and they did get a good evaluation from them. And they have worked with the Department of Social Services, and they received an excellent evaluation for doing roofing, paving, and facade work in the past. And with that, we will take any questions.
Okay, so let me take it to a vote. All in favor, please say yes.
Yes.
Opposed, say no. Solution approved. Thank you so much.
Thank you.
Thank you.
So the next one is number 8, authorizing the New York City Health and Hospitals Corporation to execute a requirements contract with Polaris Electrical Construction Corporation for a not to exceed amount of $8 million to provide electrical related construction services on an as needed basis at various NYC Health and Hospitals facilities over a term of 2 years, and presented to the Capital Committee on January 19th, 2024.
Good afternoon. Once again, I'm Manny Saez. I'm joined by colleague Menji Endar, AVP for the Office of Facilities Development. A bit on the background, the 3 electrical and mechanical HVAC contractors were awarded in 2022 to Gemco, McFarnagill & Sons, and EIA Electric, but initially EIA Electric has ceased doing business. We are looking forward to entering into contract with 1 new vendor so that the 3 active contractors are available to meet demands throughout our system. Each contract is worth $8 million for a 2-year period, and the current contractors on file are again Gemco and McFarnagill & Sons, awarded $8 million each. I'll hand over the presentation to Menji.
Thank you. Good afternoon. So as Manny mentioned, we had to do new procurement to replace EIA. Public bids for that procurement were opened on November 11th, 2023, and 1 contract with a value of $8 million was awarded. The lowest responsible bidder at the time was Polaris Electrical Contractor with a multiplier of 1.19. Polaris has received a good rating in MOX from FDNY, and they have no past H&H experience. Next slide. Next slide. Thank you. So Polaris presented a 30% MWBE contract utilization plan. They have 2 subcontractors, Millad Contracting and Skyline Contracting, that make up their 30% MWBE plan. Next slide. And this is the request to enter into contract with Polaris Electrical. Happy to take any questions.
Okay, any questions from board members? Hearing none, let me ask for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much.
Thank you very much.
So let me move then to number 9. Authorizing the New York City Health and Hospitals Corporation, the system, to execute an 8-month extension contract with Hawkins, Delafield, and Wood LLP, Hawkins, to continue providing bond counsel services related to the structuring and continuing implementation of the system's tax-exempt financing program for the period beginning December 1st, 2023 through July 31st, 2024, under the same terms and conditions of the existing contract at hourly rates set forth. partners, $4.65 per hour, senior associates, $4.15 per hour, associates, $3.90 per hour, junior associates, $2.45 per hour, and paraprofessionals, $160 per hour. This was presented to the Finance Committee on January 8th, 2024.
Thank you. I'm Linda DeHart, Vice President in the Finance Department. I'm joined by Pauline Locke, who's Senior Director for Debt Finance. Bond counsel services, specialized services of experienced bond counsel are needed to prepare and review documents, issue formal independent legal opinions related to security and tax law and other areas, and to provide legal advice related to the system's capital financing program. So it's very important for us that we don't have a lapse in these services. Hawkins, Delafield, and Wood LLP has served as bond counsel since 1995 and was most recently selected to continue serving in that role through a competitive RFP conducted in 2018 under OP 40-58, which governs debt finance and treasury operations. That OP requires presentation to the Finance Committee and approval by the board. This 8-month extension contract will provide for continuation of bond counsel services until the awarding of new contracts under an RFP for comprehensive legal services, which will include bond counsel services, that is being conducted now by the Office of Legal Affairs. The bond counsel staff, as noted, will be paid on a per-hour basis based on existing rates. We anticipate the total cost on this contract will be well under $1 million. So again, the request to the board is approval of a resolution authorizing the New York City Health and Hospitals Corporation to execute an 8-month extension contract with Hawkins, Delafield, and Wood LLP to continue providing bond counsel services related to the structuring and continuing implementation of the system's tax-exempt financing program for the period beginning December 1, 2023 through July 31st, 2024, under the same terms and conditions of the existing contract at hourly rates set forth: partners, $465 per hour; senior associates, $415 per hour; associates, $390 per hour; junior associates, $245 per hour; professionals, $160 per hour.
Any questions from board members? Okay, so let's vote on the resolution. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Thank you so much. We now move to the
And I will not read the report, but I'll cover a couple of the issues that I think would be most interesting for us to discuss. We have had a good year that closed. Highlights for me were the opening of the Ruth Bader Ginsburg Hospital, first hospital to open in New York City in a very long time. The Health and Hospitals' amazing work with our partners in Department of Social Services and Homeless Services and Immigrant Services in caring for the asylum seekers, and our loan repayment program, which is, I think, very innovative to try to increase the number of behavioral health staff that we have. I'm sure people have read about the state's announcements, SUNY's announcements about the downstate campus. Natural people will have questions about it. The basic issue, and well explained, I think, by the president of SUNY's memo to staff, is that the university hospital has a huge amount of physical problems. The hospital itself, it floods, it leaks, they have humidity issues. And the cost of either replacing the hospital or rebuilding the hospital are quite high. There's, the SUNY chancellor estimated it at $3 billion to rebuild and $4 billion to fix, which is just a sign of that often it's more expensive to fix than to start from scratch. But starting from scratch then means having land and a bunch of other issues. And so the chancellor has asked the question of what is the future of that hospital and how do we answer the really important needs of the Brooklyn community. And where we get involved, so I mean, this is not our decision. This is not a board decision. This is the SUNY board needs to determine the future of that hospital and whether they're going to rebuild, whether they're going to fix, what they're going to do. On the other hand, we have a hospital across the street. And were that the university hospital to stop tomorrow functioning, which we do not believe that is anywhere in the cards, but were it that to happen, we would have many more patients to take care of at Kings County than we currently have staff or physical space to take care of. So our viewpoint is we want to be part of whatever the solution is. We're not driving the solution. The SUNY chancellor has set out a nice process to involve the community residents downstate in what the future is. We know that the medical school is an incredibly vital resource. Medical school produces a large number of doctors, and they are from a very diverse background. They fit our patients. We want to continue to be able to recruit them to work at our facilities. We want the medical school to thrive. For the hospital, we want to work toward whatever solution is determined. So if it's a rebuild, that's great. If it's that the hospital is not going to be able to continue beyond a certain date, then we would want to be involved in making sure that there is an orderly transition of patients. And it would not just involve us, it would likely involve Maimonides, which also has a large number of their residents currently, and as well as probably some of the other hospitals in that area. One positive for future efforts is that our board already has an affiliation with SUNY Downstate. We already employ SUNY doctors. We already do clerkships with SUNY medical students. We already do have SUNY residents rotating through us. So there is a framework. If the desire is that we would do more, we have an existing framework for doing that. But again, we're getting lots and lots of understandable questions. Can you do this? Can you do that? Can you do this? And from my point of view, the beauty of what the SUNY chancellor is that he wants a process that involves all the stakeholders. So this is not a moment for us to be, we can do this, we cannot do this. This is a moment to say, we will be part of a positive plan for Central Brooklyn. We are a big provider there, and we want to be helpful. So I want to hit a couple of other points. The Elmhurst Forensic Psychiatric Unit opened on Tuesday for women. That unit had been closed during COVID. It needed to be rebuilt, and now it has been rebuilt. So that's a very positive thing. Also at Elmhurst, we opened up the lifestyle medicine program. We want to be everywhere through the city. It's been incredibly positive. We got $1.1 million from the Brooklyn Borough President for infrastructure improvements and enhancing patient services at our Gotham facilities, which we very much appreciate the help from our borough president. So with that, I'm happy to either answer questions or hear your suggestions for going forward.
So SUNY is concerned about how their students will get seen and concerned about the hospital being there?
In order to run a medical school, you gotta have placements for your students. So right now, SUNY Downstate places its students in its own hospital, in King's Hospital, and in Maimonides Hospital.
You say its own hospital, but
Right, so Downstate Medical Center consists of the School of Medicine,
Oh.
School of Nursing, School of Public Health, School of Business, and a university hospital that is run by the state of New York under SUNY as the part of the state that runs it. So one of the major concerns is if they are not able to rebuild the hospital, how will they make sure that their students get appropriate placements?
Got it.
And that's a place where we can be involved if that's the direction that it goes. And again, we are helped by the fact that we already have their students. That's not a new thing. And again, and we're not the only people who have their students. And you can run a medical school quite well. Not all medical schools have their own hospitals. Medical schools must be affiliated with a hospital, but you need not have your own hospital. And even with them having their own hospital now, it's not adequate. It doesn't provide enough placements. That's why they have their students at King's and their students at Maimonides as well.
I learn every day.
Don't we all?
Good, okay.
Please, Finn.
So, going back to the Bergen Commission days, one of the things the Department of Health did was to do this absorbability formula and to looking again just at the patient portion of this. The academic piece, I think, is probably in some ways easier to deal with. Has anyone done that, and do we have a sense on our side that if they were to close tomorrow, are we able to absorb the patient load from downstate?
Sure. If they were to close tomorrow, King's could not absorb the entire census. But instructive at this sort of polls, and this is more as an intellectual exercise, remember we closed Woodhull when it flooded, which is about the same census as University Hospital. And we closed it in one day, but all the patients did not go to one hospital, which is why if that university hospital is not rebuilt, the solution would have to be multiple hospitals doing a portion. So their census runs between about 130 and 150. And children and pregnant women are not an issue. There's enough capacity for, right, just because they're different wards. The real place that the city is tight is medical surgical beds and ICU beds. That's really the pain point. It's not ORs, and it's not obstetrics, and it's not pediatric wards. So once I don't know the numbers, but I'm sure of the 130 to 150, some portion are children, some portion are pregnant women. Those people will easily be accommodated. The med-surg beds, we certainly do not have at King's Hospital 110 empty beds, nor does Maimonides, nor do the other Brooklyn hospitals. But if you did a careful planning, I think you could figure it out. And that's part of why I want to be involved in the planning, because what I don't want, and I think this is what people worry about, nobody's going to close the hospital, but what if there's a storm that closes the hospital, right? What if the hospital becomes not usable? Then you really are solving the way we had to solve with Woodhull, right? While if the decision, again, I think number one decision, and it's only a decision that the state can make, we're rebuilding the hospital, we're not rebuilding the hospital. They have to make that decision. If the decision is that they're not building the hospital, then I think you have to get to the question of, where. Remember that also some portion of the census will be determined by nearest hospital. So, right, not everybody who would go to University Hospital now would King's necessarily be the nearest hospital, right? It varies, right, depending upon which direction you're coming from. So it would require everybody, looking at it. And again, I think where we are best is sticking to we want to be part of the solution, whatever this broader process holds.
Good. I know it's, it's time, and I'll be wanting to get out too, but this is a very important question. When you say SUNY, we talking about City College and stuff
State,
like that?
remember, it's the State
Okay, what are we
University
talking
of
about?
New York.
Oh, we talking about the state? Okay, I just need to get clear. Okay.
But it is confusing, it was confusing to me to learn that CUNY, the City University of New York, is also supported by the state.
Yeah,
So it gets a little confusing, but they are, SUNY is a separate organization completely from CUNY and completely separate from us.
yeah, it's tricky. Yeah.
They have psych beds at university?
Excellent question. Fortunately, no.
Mm.
They do have some capacity for handling psychiatric emergencies, but fortunately, it would not be a drop in, and you're right, because I didn't mention that obviously is another pain point in the city is enough inpatient beds, but they're not running any inpatient beds at the current time.
So, Dr. Morse?
Just one other kind of comment and question about the SUNY closure. The timing is tough, of course, because residents are in the midst of figuring out the match and trying to figure out where they're going to rank, and so this certainly is disruptive in that way. But the question I had is really more around subspecialty care, since that is so constrained already, particularly in central Brooklyn. The burden of cardiovascular disease is kind of one of the highest in the whole entire city. And then SUNY also has a kidney transplant program that is tremendously important. So I'm curious kind of around the subspecialty side, if there's any conversation, since to me that seems to be even the biggest constraint in so many ways.
Sure. Well, I mean, I'd say the good part of that is some of that's outpatient. And in the chancellor's plan, one of the things that he specifically said was that he wanted to use money to enhance outpatient practice. So even kidney transplant, your surgery, and again, ORs are not so much an issue, although whatever hospital stay beyond that would be an issue. But the outpatient part, I think, would be covered. I think the inpatient harder, especially if they build. But I was going to ask you, and I don't know if everybody remembers that you're a practicing physician at King's Hospital on the inpatient service. And so I was interested what your perspective was as somebody who, actually sees patients in that setting.
It's very busy. It's already extremely busy at Kings County. So I think the concern about both, inpatient med-surg beds and just, again, overall capacity it's a concern.
Yeah.
And particularly because of the opportunities now to increase access to kidney transplant for a number of people who've been waiting, I worry again a lot about that. So, but Kings County is extremely busy.
Yeah, that's very much my impression.
Okay, so thank you so much, Dr. Katz.
Thank
So
you.
the committee reports were emailed to you and are in your folders for your review and submission into the record. Are there any questions or comments about the reports? So is there any old or new business to come before this board? Hearing none, the board meeting is adjourned.
This meeting is no longer being recorded.